Hey guys, it's Amy. I am finally back with another rheumatoid arthritis update and general health update I must say general health update in general, but you know what I mean. So, I have a list here that I'm going to try to cover. I have quite a few points to cover because a lot's happened since the last update. So this video is probably going to be on the longer side, and I apologize for that, but it is what it is. So, basically, I'll start at the beginning. So, at the end of April, I'm a musician and I was playing some concerts. I had one concert one night and the next night I had another concert. And between those two concerts, I decided that I was going to get an upper respiratory tract infection. So it was really hard for me to breathe and I play wind instruments, so it was very hard for me to get the air I needed to play, and not playing wasn't an option. So I went to an urgent care because it was on a weekend, and they hooked me up, opened my lungs and everything so I could get through the concert, and it was good. And they gave me a steroid shot, like an IM steroid injection, I think. Some sort of IM injection. I want to say it was steroids, but I don't know. Which I'm not new to. It's fine, but this one is different. Like, it didn't hurt at all until I started to walk, and then it's like my hip just seized up completely, and I couldn't put weight on it, I couldn't walk on it, I couldn't do anything, and I was like, okay. So anyway, I just went home, rest. I got through that concert, and my hip eventually went to normal, and it was fine. But that night, I was laying in bed, and I was hit by the most, I don't even know, it was just awful, awful pain. And it was like, between the bottom of my rib cage and my hip on the right side, and it was just like, I don't know how to describe it. It was intense. It's like the only word I can really use to describe it. It was really intense. But eventually it died down and it went away, and I was like, okay, whatever that was, maybe it was to do with the injection. Well, throughout the next day I kept getting those pains, and they would happen, and just, I mean, I'd want to fall on my knees and be like, whoa, what's happening? But they would always go away, so I never thought that they would be anything significant. But I did make an appointment with my general practitioner, and I made the appointment after I discovered there was blood in my urine, and I was like, well, there's something going on then, because like the pain would happen so horribly, and then it would go away, and I would use the bathroom and there'd be blood. And I'm sorry if that's TMI, but like, that's what happened. And I was like, uh-oh. So I'm nothing new to that either. I've always had issues with my kidneys and urinary tract infections ever since I was, I think my first, oh god, I don't know, like when I was young, like 5 or 6, you know. So I went to my general practitioner, and she's like, well, you definitely have a UTI, but I think you also have a kidney stone. So I went for some sort of scan. I think it was a CAT scan, or CT. Is there a difference between a CAT scan and a CT? I don't know. But, and it was negative. So I was just like, okay, well, this is just a really bad UTI. But the pain wouldn't go away. Like, I had finished my antibiotics, I did all that, and the pain just would not go away. So I went back to my GP, and she was inspecting the area, making sure there was nothing like bruised or discolored, and she discovered that I had a rash like in the middle of my back on the right side. And she's like, and she started like, you know, just rubbing it like with her hand, just so gently, and it just made me jump. Like, don't do that. Like, I'm not kidding, don't do that. And she's like, I think you're starting to, you have shingles, but this is a very atypical rash, but the pain you're having right there is nerve pain. So I was like, well, that's just great. So I went home. I had gotten some more antibiotics, and I went home, and it turned out to be shingles, because it was starting to, by the end of that night, it was starting to wrap around a little bit, you know. So I went back the next day and saw her again, and I was like, look, I guess you hit the nail on the head with this. So I got some medication for that, and antivirals and everything, and that weekend was graduation for me, and I really didn't know if I was going to be able to walk at graduation, because, I mean, having an upper respiratory tract infection, UTI, and shingles all at once, just, it was not cool at all. But I did. I walked at graduation, and no, I technically haven't graduated yet. I still have one more test to take, or proficiency to take, and then I can't take it until the fall, of course. But okay, sidetracked. So where was I? You know, I had all three of those, and the pain wasn't getting any better. Like, it was going lower as far as the initial pain that I had that sent me to the GP in the first place. And so I went back again, and they said that they thought it was just referred pain from the shingles. And he really, I have two GPs pretty much. They're in the same office, but I see them interchangeably. So if I say she and then he, you know. But he really explained how like shingles works and everything, and it made a lot of sense. I was like, that must be what's going on. So I waited an extra week that month. Like, I went 5 weeks before I got my infusion instead of 4, because I wanted to make sure I was on the mend and I was better and the shingles had cleared up. And I think I wound up waiting 2 weeks, 1 or 2 weeks, I'm not 100% sure. But so I went to get my infusion of Actimra, and I also had some blood work to be done for my rheumatologist. And I had them pull it at the infusion because it's just easier that way. I think my hospital hates me because of my veins anyway, so if they only have to do it once, they're happy. So I need to check my list. Oh, so I had my infusion. I was feeling on the mend. I was feeling good, and I got a call from my rheumatologist's office, and my liver enzymes were too high to continue the therapy path that I was on. And that was bad news for me, like, because Actimra was managing it, you know. It was like, it wasn't wonderful, but it wasn't horrible, and I felt like it was managing it, and I could live my life, and it was great. So it was hard, so I had to stop Actimra, Areva, my cholesterol medication, anything that went through the liver, and like Tylenol products, I couldn't do any of that. So then, let me think. I had to stop all that, and then I had to wait for, I think, 1, 2, 3 weeks before I could actually see my rheumatologist. So it was 3 weeks without that medication. And the next day after I got that news to stop all that, I went to the eye doctor, because you have to have yearly or at least 6-month yearly kind of eye checkups for if you're on Plaquenil. And my last checkup was fine, so I was like, oh, this is just a checkup, it's gonna be fine. No, it wasn't fine. My eye doctor saw in both eyes like the beginning signs of the damage from the Plaquenil. So I stopped Plaquenil. So literally I was not taking anything except Celebrex and Fibromyalgia and Cymbalta and over-the-counter like ibuprofen. So that's all I was taking, and it was pretty miserable. And then I'm not one to, like, I'm very organized, and I know I don't miss appointments, you know, I just don't. And my rheumatologist appointment was at like 8:15 in the morning, which usually isn't too much of a problem as long as I set my alarm, and I did. But this morning, I do not remember it going off. I do not remember me turning it off, snoozing it. I mean, I knew it was on because I checked it and checked it and checked it. I'm just like, I have to make sure it's on. So I wound up missing my appointment and having to wait another week. And literally that week that I had to wait was the worst I felt with rheumatoid arthritis in a long time. Like, it was just absolutely devastating having to wait another week. And that sounds ridiculous, but it wasn't fun. So right now I'm not on anything except Celebrex and Cymbalta, which Cymbalta I use for depression as well. And I got blood work done at the appointment. Unfortunately, my liver enzymes and cholesterol are too high, because she wanted to try me on Xeljanz, which I was all about once I researched it and knew what it was, because it's a pill. I could take a pill, you know, that'd be great if I didn't have to do infusions or injections or anything, but unfortunately that's not an option right now because the liver enzymes and cholesterol are too high. And they just called back, asked me what other what others I had tried and what the reaction was and why I had to stop them. And it just, it sucks. And not to mention, I saw, when I went to my appointment, she had a resident with her. So I saw the resident first, and he was just going over everything, asking me, and he's like, do you take any over-the-counter medications? I was like, well, I take a multivitamin, I take Motrin and ibuprofen and stuff. And he's like, you're taking ibuprofen with Celebrex? And I said, yeah, I've been doing it for years. Well, apparently, you can't do that because you'll kill your kidneys. So, literally, I haven't been able to take anything except my Celebrex and Cymbalta. And honestly, it's literally moment by moment right now. So that's where I'm at right now. It sucks, but I know that I'm strong and I can handle it, and there's something out there that'll work. I just have to find it, and I have to be patient, and it'll be okay. But, you know, just a word to the wise, don't go too long between your rheumatology appointments, because that's kind of what led up to this. Because I had seen her back in December, January timeframe, and my medicines are working, and every time an appointment would come up, or not every time, when the appointment came up, I just canceled it and said I'd reschedule it later, and I never rescheduled. So just be aware of that. Stay up on your stuff. So that's where I am. That's the update. Sorry this video is kind of long, but yeah, I'll do my best to update you guys as to what therapy path I'll try next, and hope you guys are doing great. Bye.